Hello, everyone. I'm going to talk about the efficacy of repeated transcranial alternating current stimulation when it is paired with cognitive training as a treatment of Alzheimer's over 3 years. Um, There are a number of treatments for Alzheimer's. The medication, as everybody knows, the most famous one, for example, is Aricept or donepezil, which is a family of cholinesterase inhibitors. And there are some new medications too. However, all of them, their efficacy to make a drastic change is about 2.5%. Um, for a stabilization of the condition, it is said that the efficacy is about 30%. There are also non-pharmaceutical treatment, such as uh, repetitive transcranial magnetic stimulation, or RTMS for short, which I did the largest clinical trial in the world, and we finished the study last year. It was double-blind, randomized clinical trial for treatment of Alzheimer's. The other one is transcranial, either alternating or direct current stimulation as a treatment, tDCS or tACS, and also cognitive exercises. And there are a number of other treatments like electromagnetic treatment, hyperbaric oxygen therapy, music physical therapy, or 40 hertz flickering light therapy, as well as the ultrasound therapies. In our Dementia Research Center, we have a diagnosis and monitoring um, uh, technologies in which we assess egocentric spatial orientation, as well as the electrovestibulography assessment, in which we try not only to diagnose but also trying to predict the response of a patient to one particular treatment at the baseline. We also collect all the physician's reports, imaging reports for every patient, and we try to using these to monitor the patients. And we also try to give the personalized treatment. By personalized, I mean we try to find the um, uh, individualized frequency for every patient and deliver the electrical stimulation at those frequencies. We have run RTMS, as I said, on 156 patients to date, and that study finished last year. And we are currently applying tACS, tDCS paired with cognitive exercise, and we have had about 60 patients, and these are longitudinal treatment. We have also had a number of patients receiving only cognitive exercise, especially during the COVID-19 pandemic. And we try to these patients to offer it to the patient longitudinally every 2 to 6 months, depending on their availability. tDCS or tACS is a simple device that delivers a current. It can be either a direct current, in that case it is called tDCS, or it can be alternating a sinusoidal waveform. Application area, we apply it to the left dorsolateral prefrontal cortex. Frequency of application, it can be DC or AC. The most common frequency for tACS has been 40 hertz in gamma band. Some people have applied it at theta band as well. Type of application, we used anodal and current, the amount of current. People apply at different current. In my group, we have applied it at 1.5 milliamp peak to peak when it is AC, and 2 milliamp if it is DC. There are a number of hypotheses to talk about the mechanism of the tACS, such as the fact that tACS directly entrains brain's oscillation, and or it leads to synaptic changes via a spike timing dependent plasticity mechanism. How about cognitive exercise? Well, the phrase use it or lose it has commonly have been applied to muscles. Um, is it true to apply it to the brain as well? Is it fiction or fact? We investigated that. At the time that I had started investigating cognitive exercise as a means of treatment, there was a paper in 2018 that was published and claimed that cognitive exercise has absolutely no benefit, neither in healthy people nor in dementia. So I questioned that if it is true or fact. We designed an app, a series of cognitive exercise. The app is called Mind Triggers, and it is available on every platform. Um, and we apply it either alone or paired with tACS or tDCS on older adults with Alzheimer's or memory impairment. The very first pilot study that we ran, we investigated the effect of cognitive exercise with and without tACS at 40 Hz. So the treatment duration was 4 weeks every day, 5 days a week. And we enrolled two groups of people. One group received only cognitive exercise, and one group received a cognitive exercise paired simultaneously with tACS at 40 Hz. Assessments were done at baseline, post-intervention, and 1 month post-treatment follow-up. And it was MOCA for screening the patients only, and we used WMS as the primary outcome measure. As I said, we had two groups, 29 individuals with mild cognitive impairment or early stage Alzheimer's. Group 1, 19, received cognitive exercises plus tACS, and group 2, 10 patients received only cognitive exercise. And it's important to note that cognitive exercise in either group were delivered with the help of a tutor. Here are the results. Blue bars represent tACS plus cognitive exercise, and orange are people who received only cognitive exercise. As you can see, both groups improved significantly compared to baseline. The vertical axis is the change in WMS score. The higher is the better. At post-intervention, there was no significant difference between the two groups, and while they were significantly better than the baseline. However, at the follow-up session, 1 month post-treatment, the group who had received cognitive exercise plus tACS kept improving and significantly, and there was a significant difference between the two groups, which means that the group who received both treatment, not only they improved significantly, but also they kept their improved status much better. So in summary, more than 90% of our participants improved significantly after a month. The other 10%, they were a little bit more advanced in their Alzheimer's stage. They neither improved nor declined. And application of tACS simultaneously with brain exercise seemed to enhance the positive effects significantly and last longer. The result was published in a paper in 2021. After that, we started the longitudinal treatment. Basically, the patients who were in that study continued to come back every 3 months. So the treatment duration again was 4 weeks in a row, 5 days a week, and it was repeated between every 4 to 6 months. And the treatment type was again cognitive exercise plus tACS. However, during the COVID pandemic, it was only cognitive exercise because it was only online. The assessment was baseline post-intervention for each block of 1 month's treatment. And the washout period, it was between 3 to 6 months between every 2 blocks of treatment. Assessments again was MOCA only at screening and WMS version 4 as the outcome measure. And tACS was delivered at 40 hertz bipolar sinusoidal. The intensity was 1.5 milliamp peak to peak, placed at F3 and FP2 of the EEG montage. And cognitive exercises were delivered through with the tutor. Here are the longitudinal results. Every point is the change respect to baseline. As you can see, people improved about 20% compared to the baseline. At this point, for example, it was 10%, but over the 36 months, over about a period of 3 years, it seems that not only they didn't decline, but also slightly improved. The higher score, of course, is means the improvement in WMS assessment. So the main conclusion is that the non-pharmaceutical treatment seems to be more effective than the medication, or at least as effective as the medication. Longitudinal treatment slows the Alzheimer's progression and stabilizes the condition. Most patients responded significantly well to cognitive exercise, but the key for cognitive exercises to be effective and helpful is its mode of delivery. If you give the cognitive exercises to a patient and let them to play on their own, it is not going to be effective. In fact, the majority will not even do it. So that's why that I'm saying that the key for cognitive exercises to be effective is its mode of delivery. Every of our patients had a tutor for it. Application of tACS simultaneously with cognitive exercise, it seems that enhance the positive effects and help it to last much longer. And the fact that use it or lose it does apply to the brain. So exercise your brain regularly. And the key point again in here is to keep a dynamic and challenging choice of exercises and challenge for the higher score. I would like to acknowledge the funders of my research, NSERC, Riverview Health Center Foundation, tACS of Canada, and also, of course, people's donation. And last but not the least, thanks to our loyal participants who come back for treatment every few months. And of course, these research could not be done without the brilliant students that I have had, as well as the volunteers of my team. Thank you. I would be happy to receive your questions.